And I think kind of the best way I can get the discussion going for this bill proposal here is I have a couple of communications I've received from different parts of education we have in the state. The first one is a letter from the Michigan Association of State Universities. It's entitled Vote No on House Bill 6058, Senate Bill 1129, and Senate Bill 1130. Those last two aren't up for right now. It says 80-20 employer health insurance mandates will drive up costs for students and families. So the letter starts, says, Dear Michigan State Lawmaker, I am writing today to convey MASU's strong opposition to House Bill 6058, all of which would drastically increase costs to state universities and ultimately the students they serve. These bills, if enacted, would not only eliminate the current cap in state law on the portion of employee health care that a public employer must pay for, currently 80%, they would in fact flip the cost constraint on its head and turn it into an 80% floor for employer contributions. In FY24, the 15 state universities spent $502 million on employee health insurance, a figure equal to 31% of the entire state appropriation to university operations. These bills will drive up costs to universities by tens of millions of dollars. The universities have done their best for over 20 years to maintain affordability for students and families despite being down $1.2 billion in adjusted state appropriations to university operations since FY 2002. Such a policy would have to be paid for through some mechanisms, including additional costs to students and families and reduced health insurance benefits to employees, thus hurting the intended goal of this legislation. Michigan's public universities are large, complex, and require multi-year budget models to ensure they provide high-quality education to students in a stable and efficient manner. They require flexibility in negotiating, implementing, and paying for what is a major expenditure. A mid-year cost increase to the universities with no advance warning or implementation period would be unbudgeted, unfunded, and untenable. We strongly urge that this legislation is not taken up during the remaining hours of this session, and if it is, to vote no. However, if the employer health insurance coverage mandate is enacted, the state must provide additional offsetting operations to support universities or risk increased costs to Michigan students. So that's the university side of it. I also, without being asked, was sent an email from one of my superintendents today in my K-12 district. I'm not going to read the whole email, but I am going to read a paragraph of it, and I'm going to not read the specific school district. I don't think we need to single someone out. It says, my school district serves many students who are already struggling academically and facing profound social emotional challenges. These are children who rely heavily on the critical resources we provide, whether it's access to small class sizes, mental health support, or after-school programming. If this legislation proceeds without supplemental funding, we will be forced to make decisions that will directly impact these services, further jeopardizing the success and well-being of our students. They cannot afford to lose any more of the support they depend on. While I support the effort to provide relief for rising health care costs for employees, this must not come at the expense of our children's education. Placing this burden on school districts mid-year is untenable and risks destabilizing the very systems designed to support the most vulnerable members of our community. I find it very interesting that two people who I have to suspect have never spoken to each other ever before. I have no reason to believe these two people know each other. The word that they used in common in both of these communications was untenable. You know, it's nice to have a talking point. Oh, we're going to help the employees. This is great. Well, guess what? It's a zero-sum game. Finance is a zero-sum game when it comes to this. If we're going to increase costs They're going to have to be made up somewhere else. At least to do this on the universities, they can increase costs for the students. That doesn't work for K-12. What do? They just have to cut costs. They have to cut services. First, they'll start going through support services, start cutting custodial staff, start cutting staff and doing contracted services if that's cheaper, if they can save money that way. Maybe cutting some programming. Well, if they still can't make up the deficit, what comes next? Now you start laying off staff. It's not going to be good for students. This is not going to be helping improve student outcomes. This is not good policy. I can't help but think there's a shift that's really starting to accelerate. The public is really starting to trust Republicans more than Democrats on education. And I don't want to oversimplify it. I know my colleagues across the aisle genuinely want to improve student outcomes. I know that's true. I want to believe that. But it's not reflected in this bill. This bill is putting union interests first. And I wish I could stay up here and speak for 24 hours. I wish I could filibuster this. But unfortunately, it's already 6:30 in the morning. I've been speaking for a lot tonight. Well, I should say this morning. I've been speaking a lot over this whole session. This is bad policy. This cost-sharing thing has worked very well. I haven't even gotten into the local government side of it. This applies to more than just schools. This applies to our local governments as well, which is a huge employer for our state. And it also pertains to the state government itself. So this is going to have a general fund impact if it actually gets signed into law. All of this stuff we're voting on, this one especially, I think it's very possible we could start next year out with a budget imbalance. We just saw yesterday the Federal Reserve came out, announced a 0.25% rate cut, but they also lowered their projections from 4 rate cuts next year to 2. And you saw the markets react. There was a 3% drop in the S&P 500. Now, I don't like to take a single data point and extrapolate that one single snippet over the whole next year. I don't want to do that. But I think it's always best to hope for the best and plan for the worst. And boy, if we come out with CREC being slightly down next year and we pass all of stuff like this, boy, we're really walking on thin ice. It's not prudent. It's not good for students in my district, and I urge my colleagues to vote no. This amendment is designed to ensure that this bill does not apply to employees who are not in compliance with federal immigration laws or who actively support government censorship in ways that violate the First Amendment of the United States Constitution. We should not reward hard-earned taxpayer dollars to those who disregard our laws. I ask for a yes vote on my amendment. Thank you, Mr. President. I rise in support of my amendment and ask my remarks be printed in the Journal.
Without objection, so ordered.
Mr. President, my amendment ensures fairness. I would hope we can agree on working for the government shouldn't come with benefits above and beyond what is working in the private sector just because the government can stick it to taxpayers with the bill. This amendment simply says public sector health care contribution rates should mirror the average small business contributions. I ask for my colleagues' support.